Hey everyone, this is Jody. I'm doing my Module 3 blog post. After completing the Leadership Skills Questionnaire, I found my results were high in administrative and conceptual skills and moderate in interpersonal skills. I thought that was kind of an odd combination because I feel like I'm a people person and I work well with people. I understand them. But apparently my skills are higher in the administrative and conceptual. I can use these skills that were shown in the questionnaire as well as other ones listed in Chapter 7 of our book, such as planning to be a good leader. Planning, I can bring focus to what we're trying to accomplish, helping a group to set goals, establishing those goals and making them clear. As far as being a manager, planning is really important so that you can direct your whole unit and keep everyone on the same page, whether it's hiring new staff and making sure timelines are coordinated for people or planning time off and vacation schedules, holiday schedules. All of that sort of stuff is really important just for the day-to-day function. Also, organizing is another skill of mine. Establishing committees within staff members helps to break down different responsibilities but still accomplish goals that are within sight. Committees give responsibility to team members and help avoid favoritism by setting out specific people that need to do specific things. Everyone will know what their task is and they can stay focused if they're in a specific committee. Also directing, being able to motivate others through positive energy, always being upbeat about things, telling people they can do it, it's going to be okay, you're going to make it through, giving clear directions so that it's no gray area, you're establishing standards and expectations from the start so that you get your desired effect in the end. And let's see, article that I found was about colorectal surgery patients that were being used in a study for enhanced recovery. The goal of this was to decrease hospital time. These patients, the study started preoperatively in the clinic. They were selected for the study, and pre-op, the operating room, PACU, post-op floors, and home care all were involved in this. Different outcomes that they made and reached all helped to improve hospital stays, improve hospital outcomes, and decrease the days of stay in the hospital. This is a great example of interdisciplinary care that's through all different facets as far as rehab, nursing, surgery, pretty much everyone. I would use articles like this if I were a manager to show my staff that what they're doing really does work. I work in the operating room, so we do certain protocols because we have found that we have better results post-operatively. The results we don't see right away, so sometimes people don't know why they're doing certain things they're doing, but having these results and seeing the percentages later can really encourage staff, and it's a positive reinforcement of why we do what we do. As a manager in my area, I would be working with lots of different departments in the operating room. I would be working with PACU, pre-op, surgery, so lots of doctors. I'd be working with anesthesia, radiology, pathology. There would also be lots of communication with ICUs and the med-surg units, just coordinating a lot of things. And my preference is for a horizontal structure. I like that there are many entities on the same level that share responsibilities to accomplish common goals. I find that it's easier to not have the hierarchy of the vertical structure, because you have an easier way to talk to your manager and your manager's manager without having to go really far up the chain of command. And I like the total quality management model of care because it uses data to base care for improvement and for safety. I think this would be a great option if I were in a management position, because I think results are what we're really after. It's really about patient safety and how we get there to make sure our patients are safe and we're treating them the way they should be and making them better. And I think that's it. Have a good night.